That's a very painful process. Hello again, this is Kingsley Ampoful and welcome to my channel. So this is Chronically bringing you the second edition or second episode in the series. So I live at Pokwasi, which is like on the outskirts of Accra, right? So I was commuting from Pokwasi to the eastern parts of the country, which wasn't too difficult because they're very close by, yes. So I was going to work every day, of course, and it started pretty well because in the beginning, it was fresh. I was now kind of learning what to do on the job. I was doing about 3 different roles again because it was a pretty small savings and loans company at the time, okay? So I was doing about 3 different roles, which was challenging in the beginning, you know. So then at that point, I think I was on 3 different painkillers and 1 muscle relaxant. So as time went on and I got more and more stressed, it aggravated the issue or aggravated the pain, and so I had to take more and more or higher doses of each of the medication that I was on at the time, and it became more and more difficult or increasingly difficult to actually get my work done because my work actually involved a lot of preparing of documents and going around talking to customers and stuff like that. So it became very difficult for me to focus at work, for me to finish these documents, and I think I had an episode or 2 where I had to take a few days that I wasn't privy to off work, and eventually I ended up at a hospital. So this hospital is a specialist orthopedic hospital, name withheld, a specialist orthopedic hospital, and it's a very good hospital. That day I went with my mom actually. So we got there, then we went into the consultation. He looked at the scans, and actually we had to go and do a different set of scans because apparently that set was kind of old. So we went to do a different set of scans, came back to him, and according to him, he sees that maybe we should try a surgical option. So then we are talking about it. He tells us how much it's going to cost. He told us it will cost between $8,000 to $10,000. Give or take a few more thousand, but it will cost about $8,000 to $10,000 to do the procedure. He mentioned the procedure would be relatively simple. He mentioned that the risks may not be as serious as other spinal-related surgeries or surgical procedures. And he mentioned also that this was his opinion, but we could come back and see any of his colleagues in the same hospital under his employ to get a second opinion because he trusts his colleagues and their opinions matter. So we actually went and came back and saw a different doctor in the same hospital, and so according to that doctor, he was like, a surgical option may be a bit rash. So in that vein, we should try and move medications about, change them about, alter dosages and alter concentrations and stuff to actually figure out if there's something that can help me to manage the pain, so that I don't have to go for a surgical option, okay? So for a few more months, I was still consulting there, and every time I would go, they would move, okay, so stop taking Celebrex, start taking Flotac, stop taking Flotac, start taking cyclobenzaprine, start taking Tramadol, start taking ibuprofen. So I was basically just going back and forth, changing medication to dosage to concentration just to see if they would help. So I was basically doing that, and then I kept changing all that, but it never really changed much about the situation. And I kept having to deal with the side effects of these drugs, which can be anything from dizziness, inability to focus, nausea, drowsiness, stomach pain, constipation. I mean, there's a whole bunch of things. But then if you really read the pamphlet that comes with the drugs, you would then kind of get a heart attack, because the kind of things that you see in there, even though they say are in very rare cases, say 1 to 2 or 3% of people who take the drug, it's kind of scary. But I had to deal with these ones that I just mentioned, on a regular. So it was a bit difficult for me to do that and then continue working. And because I basically couldn't focus, I was basically drowsy and sleepy all the time, and my work was very, very active. So eventually I thought it wise to still let it go again. This is after a period of time, say almost 6 months. Let it go again and then find a way to properly manage my condition. So the first one was actually finding out a proper diagnosis. This one was to actually find a way to properly manage the condition so that I can sort of function in a 9-to-5 working environment. So I let go of that job as well, and I was still consulting at the specialist hospital. So I then went back there. They referred me to another anesthesiologist who was working in the same hospital, and he suggested that I try something called epidural injections. So then, so an epidural injection is basically, or usually an injection that is given to a pregnant woman when she's going into labor, if she doesn't want to feel the pain, or to numb her, abdominal region so that childbirth becomes easier. That's what it's usually used for. But in my case, they would actually put like a receptacle in my spine and then inject several steroids and painkillers into my body to help curb the pain. So according to them, this could work anywhere from 1 week to 6 months, depending on the person and how your body is and everything. So I decided that I would give this a try. So I went in for the first, like a mini procedure. They have to inject the area with a local anesthetic, and then inject the receptacle like deep into your spinal cord, and then inject the steroids and stuff into that. So I went for that. It's a very painful process. So I went in for that, and so the first one I could literally feel like the liquid moving through like my back into my legs and going all the way down to my toes. It's a little bit freaky, but that's what I had to deal with. So after that, the first one actually made the whole thing worse. I couldn't walk for almost up to a month. I was literally in my bed being brought food. I made it to the washroom on my own because I could like hold or support myself on the wall and go to the washroom and stuff like that. So I went back to this place and they asked me to come and do a second epidural injection. So I went in again and then had the injection done. For this time, I had relief when I had the injection done, but the pain relief only lasted for 1 week, and then I had to go back in. So when I went back in, they asked me to come and do it a third time. So I went back in again to have the same procedure done for the third time, and this was all within the span of like a month and a half. So the third time was even more painful. After that, I had pain relief for up to about 3 weeks, 2 weeks, 2.5 weeks. And after that, the pain just came back. So I went back to this place and saw the anesthesiologist, and according to him, I can't keep doing this procedure as and when I need to, because I can only have up to 4 of them a year. And if I'm supposed to do them frequently, it would actually cause fibrosis in the area that they keep doing it in. So fibrosis is basically scarring. So if eventually they need to operate, it would be much more difficult for them to get through the scarring to operate. So then I decided that I would just stop consulting with this place, because it got to a point they were literally just, okay, so go and see this doctor again, and go and see this doctor again. And there were days I literally had to pay double the consultation because I was seeing more than one doctor. So I had to pay double the consultation. And so I decided that I would just try and find another option. So basically, I'm going back and forth from not being able to walk, to using a walking stick, to sometimes walking on my own. I can be outside, you see me, and I look perfectly normal. I look perfectly fine. I look like everything is painless and I'm fine. So you may see me tomorrow, next week, next month, and I look fine. But it's the thing with invisible illnesses. It's something that I go through internally, so you can't see it. It's difficult to relate or understand somebody who is going through something like this. But all I would say to you out there is that try to be, if you know about something like this, or you know somebody going through something like this, just try to be a little more considerate, and try to understand when they say they can't go out, or they can't meet you at said restaurant, or meet you out, basically. So try to understand people like me who are going through this stuff. It's not as easy. I don't know if I'm making it sound easy, but it's not as easy as it may sound. So basically, that's the story, okay? There's still the day-to-day. There's still many things that I want to talk about or address. There are still a lot of subjects and topics that we can look at different angles. So I just want to say thank you for watching and listening to my story, and please subscribe. It really does help me. And then please click on the notifications bell so that you can be notified if I post a video or anything like that. So thank you very much, and see you next week. We will talk more. Bye.